Hello, my name is Annalie Martin, and today I'm going to be discussing the week 3 skills, which include the hemoccult testing, occult blood, discussing the need for a stool sample, um, and everything that goes along with that, different ways to estimate blood loss, and the three objective ways to estimate blood loss, and diet and discharge teaching. When testing occult blood, you're going to want to document the method used to obtain the specimen and transport it to the lab. If testing is done by the nurse, you want to make sure you document the results and communicate the results to the healthcare provider. Documentation, any significant assessment findings, and the characteristics of the stool, the COCA. And the purpose that you would do this is you want to detect GI bleeding, you want to help in the early diagnosis of colorectal cancer. You may want to obtain a stool specimen for FOBT, and that may be delegated to nursing assistant personnel or any nursing, or to an unlicensed assistant personnel. So you can delegate this. You also want to make sure that the person is qualified to be able to do the task. So how you would do this procedure is you're going to, of course, wash your hands, identify the patient, verify the order, discuss the need to the patient. You're going to want to check the label and their identification bracelet if you need to send it to the lab. The label should include the patient's name, ID number, the time that the specimen was collected, the route, and then identification of the person obtaining the sample. This can also change depending on company policy. You are going to want to make sure that you have everything in your reach, that the patient has privacy, and you will want to place the plastic collection receptacle in the toilet if they're able to, and help the patient go to the bathroom or on the bedside commode. And you don't want the patient to urinate in the pan. So after the patient defecates, you're going to, of course, perform hand hygiene, put on gloves, and then if you're using the GFOPD, which is commonly used, then you want to open the flap on the inside of the card, and with the wooden applicator apply a small amount of stool from the center of the bowel, and move it onto and then you're going to put it onto the one window of the testing card. With the opposite end of the wooden applicator, obtain another sample from another area, and apply a small amount of stool onto the second window of the card. Then you're just going to close the flap, and you may want to send to the laboratory, and that would be in a biohazard bag. If you are testing to the point of care, then you just wait like 3 to 5 minutes before developing. Open the flap and place the developer, 2 drops of the developer, and then wait based on the directions. If you're using an FIT, open the flap on the sample side of the card, and then with the applicator brush or sampling probe, apply a small amount of stool from the center of the bowel. Movement onto the top of the window of the testing card. With the opposite end of the card, you're going to obtain another sample of stool from another area and apply a small amount of stool onto the bottom half of the testing card. Then you will want to use the applicator to mix the samples and spread samples over the window, and then you're going to close the flap and allow it to dry, and then you would want to send that in after reading the results. Let's see. So, the next thing I am going to talk about is ways to identify blood loss, which could be drainage, it could be the circumference of the wound, it could be urine, a bowel movement, and you could assess the losses from the NG tube, blood drains like a Jackson Pratt, diets, and then when it comes to the diets, I have here that you may have certain discharge diets. So one example would be with Coumadin, you may have restrictions of leafy greens and alcohol. With Lasix, you have to consider that they've read potassium, so make sure you have your patient eat bananas. And potassium, you wouldn't want them to eat salt. There's also with calcium channel blockers, you would want to instruct the patient not to eat grapefruit. So there are, with depending on the medication and depending on the condition that the patient has, you're going to want to make sure that they understand how care for that. And even if they have like a drain, you're going to, like with the Jackson Pratt, you're going to want to show them how to get the air out of that so that it can have the proper effect in draining. And with the wound, whatever type they have, whether it be a closed system or open system that they have draining that, you might want to teach them how to do that, or even if it's just the proper bandages to use and proper cleaning techniques, you're going to want to make sure that they know that when they get home to prevent infection. Thank you.